Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. COVID-19 has drastically altered our daily lives on many fronts, and a recent survey says that 27% of compliant women plan to either skip or delay their mammogram in 2020. Grammy Award-winning artist and breast cancer survivor Cheryl Crow is joining us today. She's joined by leading OBGYN Dr. Dr Albright. They're joining us today to talk about why women should prioritize scheduling their annual mammograms. Good morning, both Cheryl Crow and Dr. Albright. Thanks for joining us today.
Good morning.
Good morning.
Cheryl, you've been here with us before. You're a breast cancer survivor. Tell us a little bit about your experience, how you're doing today, and why you're so passionate about women taking care of their breast health.
Well, I was diagnosed in 2006 from just a routine 2D mammography, and I was the picture of great health, no family history. I just basically was being diligent about making sure I got my mammogram every year, and lo and behold, something strange was spotted on my screening, and they said come back in 6 months. But rather than waiting, I went ahead and had another screening done, and I was diagnosed with stage 1. It was very out of left field and definitely a game changer.
Game changer indeed. So what's the message that you'd like to share with other women about the importance of breast cancer screenings today?
So my message is one of making sure that we stay diligent to getting our yearly mammogram set up, and I am the poster child for early detection, and early detection definitely saves lives.
And Cheryl, I understand that you're doing a private virtual performance. Tell us how we can be one of 10 fans or so that are going to be able to attend.
As we come up to October, which is Breast Cancer Awareness Month, I'm encouraging every woman to go on to backtoscreening.com and set up your reminder. And who knows, you may be lucky enough to be one of the 10 winners who gets to be a part of my virtual concert in October.
I'd like to ask you, Cheryl, how are you doing today?
I'm doing great. Obviously, these are strange times, but my health is great. I'm doing what everyone else is and should be doing, wearing masks and keeping socially distanced. I don't consider myself to have a pre-existing condition because I'm cancer-free, but I am taking the opportunity to make sure to tell people, even though this is a weird time and we are all very nervous and conscientious about not spreading or contracting the virus, it's important to set up our mammogram to make sure we take care of our own health, because we can't take care of the people that we love unless we take care of ourselves.
Absolutely, and well said. Dr. Albright, why is it so important, especially now during this COVID-19 pandemic, that women schedule annual mammograms?
Well, unfortunately, there's a statistic that about 10,000 breast and colon cancers are going to be missed due to delays related to the pandemic. So that's an important fact. We don't want anyone to miss a breast cancer. Early detection actually does save lives.
Okay, so you're aware of the importance of screening. You've done your planning. You plan to get a screening, but you miss it anyway. What should women do?
If someone did miss their appointment or a screening because of the pandemic, what should they do? Obviously get in right away. But along that note, too, if you could add the precautions that many doctors' offices are taking to ensure that people are safe.
Cheryl, is there anything that you'd like to add?
Well, you said the first thing is reschedule as soon as their radiology center is open, and most are actually opening now. They can call ahead if they want to make sure that they are practicing according to CDC guidelines. But most are wearing masks to protect patients and staff, and they are increasing the time of the appointments so patients don't have to sort of cross paths once they are going in and out of the facilities. Waiting rooms are set up so that social distancing rules can be applied. So most centers are making certain that patients should feel really comfortable and really safe going in for screening.
Great. Now, I know we mentioned that virtual performance that you're going to be doing. Where can our listeners go and get more information about that performance and about breast cancer screening awareness as well?
Go to backtoscreening.com and you'll just follow the steps. And it's really setting up a reminder to make sure that you set up your annual mammogram and that you stay diligent about taking care of your health.
I thank you both for joining us here on Health Professional Radio this morning, Cheryl Crow and Dr. Dr Albright.
Thank you.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Cheryl Crow and Dr. Dr Albright. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.